All right, good afternoon. My name is Phyllis Meadows, and I'm a member of the Roundtable. And I'm hoping at this time of the day when we've heard such amazing presentations, lots of wonderful information, that this is a time for a little bit more reflection, a little bit more action, and a chance for you to sort of get your creative juices moving, all right? So one of the things that you might not know about the Roundtable, but not only are we committed to learning and really being able to share some of the latest and greatest insights into what's happening around population health, but we're very committed to action. We really want people to be thinking about how they can move this information in their respective communities, in their workplaces, et cetera. So for the next hour, we're going to engage those of you who are in the room in an exercise that we hope will begin to sort of pique your thinking about, given the information you've heard today, how might you take that information and begin to move it into a leadership space, to really assume a leadership hat. Oh, I got slides, okay. Assume a leadership hat. Now, I'm going to walk you through a vignette in a few minutes, but what I want you to do in this exercise, I just want to give you this caveat. I don't want you to think about this too heavy, because the vignette that I'm going to share with you is probably not as explicit of all the questions that you might have to answer, but we really want you to just start thinking. And you've been in listening mode, now we want you in thinking mode. We want your creative juices, and I asked our team, our planning team, what do we do with this information that we get from folks who are in the audience? And they said this is going to be part of the transcript, so we need to hear your thinking as a roundtable. You're going to have to work quickly, so I'm not going to spend much more time giving you the details. And then what we really want you to concentrate on as you sit together in your small groups is to really be thinking about the leadership aspects of this work. And how do you assert leadership in this work? So you've been passed out a handout that's called, well, I don't know what it's called, but the focus of it is to really focus on a sort of makeshift city that I think is very common in many cities that you see across this country. And the city is called Ourlandia. It's a fictitious mid-sized city, not like many unurban areas that you might see across this country. And I just want to walk you through just a little bit of just imagining what the city is about. So welcome to Ourlandia. Ourlandia is like a mid-sized city, once the nation's leading manufacturer of industrial glass. Lots of changes have happened to the city over the past few years. Although it made fortune in the glass industry, lots happening in the manufacturing world in this city. And the city has been very slow in transitioning to these changes that are occurring in the economic status of the citizens and the community. The population is declining. It's gone down by 15% in the last 30 years, and the expectation is it's going to continue to drop with time. Lots of diversity in this community, and along with that diversity, a lot of social challenges, as you know. There's some extreme inequalities in wealth, poverty, educational status. There's segregation occurring as the city shifts, and some challenges in living for people of color. The health status of the community is shifting as well. Lots of chronic illnesses, addiction rates are going up, suicide, all of the challenges that we see in health across the country. Not only the physical health is declining, but there are some physical aspects of the community that's changing as well. Life expectancy is declining. And the people who live there, about 60% of the people believe that the next generation who grow up in that city are going to be worse off than their parents. Now, that probably sounds like just terrible place to live, but there are some assets in that city. There is a great sense of inclusiveness. There's a value for that, and the people in Ourlandia are very much pioneers. They're hard-working, salt-of-the-earth people willing to work across the differences that they see emerging. And then the leaders in that community are trusted. So they have a number of very powerful assets. Now, the way we're going to work this afternoon for the next probably 50 minutes that you have, we're going to spotlight two sectors, healthcare and business investments. And in Ourlandia, there have been some wonderful things happening in these two sectors. There's a main hospital, which has been an anchor hospital. There's some smaller hospitals also there. But that main hospital has been an anchor. And then there are a lot of small companies on the business investment side who have really begun to take on some of the social investments that we've been hearing about today. The big banks haven't been quite as active, but they also have a large pension fund, lots of assets financially that folks are really thinking about and rethinking how those funds can be used to help shift the renaissance of the city. So for the time we have, let's see what we have next. Your charge is we're going to ask you to divide up into two groups. And I'm not quite sure how to do it. We've got about 25 people here. We did have, like you assigned earlier when you registered. I don't know if that's going to work. But we're going to have you divide up into two groups. Okay? You're either going to be on the hospital side or the pension fund side. And if the numbers don't work, I would suggest stage right would be the pension folks, stage left would be the hospital folks. And for the roundtable members who don't have an assignment, we're going to spread ourselves out. Okay. When you think about your role as either the hospital side or the pension fund, there's some details in your package that will sort of guide you to what some of the roles and strategic imperatives could be. And I want you to begin to answer the 4 questions that are listed in your package. Okay? Keep in mind, one role, so you don't, if you're on the hospital side, I don't want you to answer for the pension side. If you're on the pension side, don't answer for the other. Once you break into your groups, you'll need to figure out who's going to record and who's going to report out. So we'll have a short report out period afterwards. You should have a clipboard with some a template for you to record on. And then we want you to think about your priorities and your values for investments based on that perspective of the group that you're working in. So you have 4 questions. I can go through those questions real quickly. What are going to be your most compelling priorities for the renaissance of Ourlandia? How do these priorities reposition you, either if you're from the health side or the pension side? What trade-offs did you consider when you set those priorities? Or what trade-offs might you consider if you were to invest in Ourlandia's renaissance? And then more importantly, if nothing else, what leadership challenges will you have to overcome in order to invest? Okay? So unless there are questions, we're going to ask you to take about the next 50 minutes. Is there something else?
Just a small amendment. We decided that since the group is big enough to break it up into smaller groups, we're actually going to have 8 groups, but one side is going to be 4 groups that are doing hospital, the other side is going to be the pension fund, and there are 8 clipboards, 4 along the aisle there and 4 along the aisle here that people will see.
Great.
And they could just gravitate to those. If there are 6 or 7 people in your group, move to a different group that only has 1 or 2 people.
There
That's
you
it.
go.
Thank you.
Okay, so clipboards are there. Enough for how many groups? 4 each? 8 groups. Okay, so 4 of each. So unless you have questions or something's not clear, because I know it's a lot of information, remember the goal, the renaissance of Ourlandia, okay, Think leadership, think creative. Don't get in the weeds. If you read all the details, you might decide you don't have enough to act, but what city has all the information it needs, right? Go to work. We'll see you back here in about 50 minutes or less, a little slightly less. We'll let you know, and then we want to hear your report out, okay?